So maybe you were just diagnosed with Hashimoto's disease and you're starting to take thyroid medication. And while you didn't feel any worse, you really didn't feel any better, right? You might be wondering if there's anything else that you can do besides taking medication to be a little bit more proactive, right? And I think if you're like most people watching this video, then you're wondering how you can take steps that are going to prevent these flare-ups and these attacks. Some of you who are watching this video went from feeling somewhat normal to being bedridden on the couch, now feeling like a cripple. Now, if I have your attention, good, because I've got a lot to talk about in today's video. I'm Dr. Hagmeyer, and I practice functional medicine. I'm certified in functional medicine. And in today's video, I want to give you an overview of what you need to be thinking about when it comes to your future and the functioning of your thyroid. Here's one thing I'll tell you, that if you think you are just going to take thyroid medication and everything is going to be okay, I hate to be brutally honest with you, but if you're in for a rude awakening, I'm hoping that this message is heard by those of you who are not yet that cripple on the couch. But even if you are that cripple on the couch right now, the things I'm going to share with you today can still make a big difference in your quality of life. In addition to going over two major mistakes that I see people making, I want to provide you with an overview of really what needs to be done in order to prevent further damage to your thyroid and hopefully, in turn, prevent these future flare-ups. Now, the two major problems that I see happening in the treatment of patients that have thyroid disease is, number one, is going years without ever knowing what's even causing your thyroid disease, right? And what I mean by that is this. Many people will go 10 years, 15 years without ever getting tested for Hashimoto's disease. And that's a major problem. You see, most doctors don't test their patients for Hashimoto's, yet it's the number one cause of thyroid disease and thyroid failure around the world. The number one cause. It's not an iodine deficiency. Why would doctors not want to test for the number one cause of thyroid disease? That's another video for another time. But it should make you question if your doctors are really doing everything they can to help you. I would argue that most doctors are not doing enough. So problem number one is really never getting tested for Hashimoto's. The second problem that I see is that many patients don't take Hashimoto's seriously. They just think that if they take their thyroid replacement, their medication, like Synthroid or levothyroxine, maybe Tyrosint or Armour or Cytomel if they've got issues with T3 and T4 to T3 conversion, these medications are somehow going to fix the thyroid. And I'm here to tell you that these two mistakes can ultimately ruin your life. And here's why. Every month that goes by where your immune system stays in this imbalanced state, it's destroying just a little more of your thyroid gland. Month after month, year after year, you're losing thyroid function. And this is why you have to ask your doctor what can be done to stop this. And if you do ask them, often you'll hear there's nothing that can be done. It's permanent. You're going to become permanently hypothyroid. In some people, this destruction happens faster than in others. Thyroid replacement medications like Synthroid and levothyroxine and Tyrosint and Armour and Cytomel, they don't fix your immune system. They replace hormones that are lost because your thyroid gland can't produce hormones on its own or may not be doing it as efficiently, but they're not going to fix the problem. And those are two major mistakes. Now, for those of you still watching, if your goal is to become more proactive when it comes to Hashimoto's, you need to stop thinking about your thyroid gland as the problem, and you need to start thinking about this as an immune system disease, an immune system disorder, okay? Instead of just sitting and idling and waiting for your immune system to destroy the thyroid gland, what if you could be more proactive? That's something you have to think about. You see, managing Hashimoto's is challenging, especially because there can be many unpredictable triggers that can cause flare-ups. But if we can identify what these triggers are and we can take the steps to fix these triggers, we should be able to reduce the frequency of these flare-ups and ultimately help your thyroid, help people that have thyroid problems. With that said, let's get into an overview of the immune system triggers that can cause and exacerbate Hashimoto's disease. Okay, so number one is gluten and other food sensitivities, right? One of the most discussed triggers for Hashimoto's disease is gluten. Again, gluten is a protein. It's found in wheat, barley, rye. Individuals with Hashimoto's disease often have heightened sensitivity to gluten. And so ingesting gluten can lead to an autoimmune response whereby the immune system further mistakenly attacks the thyroid gland and begins to destroy it. Other common food sensitivities include things like dairy and soy, and obviously certain grains. Eliminating these foods from your diet can sometimes significantly reduce symptoms and improve your overall thyroid function. Number 2 is chronic stress, right? Stress is a well-known trigger for autoimmune diseases, right? And that is including Hashimoto's disease. High levels of stress really disrupt the immune system. They increase inflammation throughout the body. They can exacerbate Hashimoto's symptoms. So techniques for managing stress are going to include things like mindfulness, regular physical activity, and of course, adequate rest. Okay, so number 3 is viral and bacterial infections, right? We know that viral and bacterial infections stimulate the immune system in harmful ways. We know that there's this infection connection that potentially triggers an autoimmune response. These infections might be things like Epstein-Barr virus, which is often cited in Hashimoto's disease. It provokes inflammation. So again, practicing good hygiene, managing infections promptly can help prevent those flare-ups. Number 4 on my list is hormonal imbalances, right? Female hormones in particular play a significant role in autoimmune activity. And this often explains why Hashimoto's disease often affects more women than in men, because changes in estrogen levels during puberty and pregnancy and postmenopause all influence the immune system, and they can exacerbate Hashimoto's. All right, number 5 on the list is going to be nutrient deficiencies, right? We all know that certain nutrient deficiencies can strain the immune system, and they can also strain thyroid function. So essential nutrients to think about are going to be things like vitamin D, vitamin A, things like zinc, selenium. These are, again, all pivotal for thyroid health, but ensuring a well-balanced diet and supplementing with these nutrients can, again, help reduce the frequency and intensity of this Hashimoto's flare-ups. Number 6 is exposure to environmental toxins. Environmental toxins such as heavy metals, mercury, lead, cadmium, pesticides, endocrine disrupting chemicals. These also interfere with thyroid function, and they can trigger an autoimmune reaction. So again, reducing exposure by choosing organic produce, using natural cleaning products, avoid environments with high levels of pollutants. Again, these can all go a long way in helping minimize the amount of stress and burden on your immune system. Number 7 is poor gut health, right? Gut health is directly linked to the immune system. Things like leaky gut syndrome, where the intestinal lining becomes more permeable. That can allow toxins, undigested food particles, undigested proteins to pass into the bloodstream, thereby provoking an autoimmune reaction and a flare-up. A diet rich in probiotics, prebiotics, and fiber, along with potentially adhering to a gut healing diet like the AIP, autoimmune paleo diet, can go a long way in supporting your immune system and thyroid health. Okay, so number 8 on the list is medications and overstimulation of the immune system. We know that most medications work by either suppressing or overstimulating the body, and that includes the immune system. It's crucial and critical to discuss these medications that you might be on with your healthcare provider to see and understand whether or not they're having an impact on your Hashimoto's. Okay, number 1 on the list is really just adopt a gluten-free, anti-inflammatory diet. Focus on whole, unprocessed foods while avoiding common allergens. Lots of information on my website about this. Number 2 is practice stress management. This is going to be things like engaging in mindfulness, meditation, prayer, and other relaxation techniques. Okay, number 3 is to ensure adequate sleep, right? Most of what our body does from a healing perspective is done while we're sleeping. So getting good quality sleep is very important. If you're struggling with sleep, work with a functional medicine practitioner to identify what might be causing your sleep disturbances so that your body can do the healing that it needs to do while you're sleeping. The next thing I want to talk about is just regular monitoring, and this often gets overlooked, right? Regular blood tests are essential to keep track of your thyroid hormone levels and where your thyroid hormone levels are. Many times patients think it's a one and done kind of thing, or get your blood work done once a year. And this is not the case. Especially if you're in a flare, it's important to get your hormone levels tested periodically, and that means maybe every 3 months if you're not noticing improvements in your quality of life and in your symptoms. Okay, and the last thing I want to talk about is really gut health and gut repair, right? We know that the gut is so important to our immune system. Things like probiotics and foods known to support gut health can go a long way. Things like zinc carnosine can help with, if you've got leaky gut. If you've got small intestinal bacterial overgrowth, that's a whole nother topic, which I've covered in a lot of other videos. That's a little bit more complicated. But if you have small intestinal bacterial overgrowth, I recommend that you check out a whole video playlist that I have on SIBO, because again, when it comes to bacterial overgrowth, most patients don't get the proper treatment for that, and so they just continue to relapse. And the last thing I want to leave off with is really just the fact that when someone has Hashimoto's, when you're living with Hashimoto's, you have to understand it requires a proactive approach. That means avoiding those triggers that cause those flare-ups. And by recognizing and managing those triggers, such as the dietary aspect, the stress, the infections, the hormone imbalances, the nutrient deficiencies, the gut health, the toxins in the environment, again, you're going to be able to significantly reduce the frequency and the severity of these Hashimoto's flare-ups. Again, I always recommend and suggest that you work with a functional medicine practitioner. Look for somebody who's certified so that you can get personalized treatment recommendations based on what your tests show.